Hello, hi, how are you doing today? My name is Temitope Shebanjo. In this short video, I'm going to be demonstrating non-parental medication. And to start with, I have here printed physician order and medication record. I'm going to be comparing the medication record with the physician order. I want to verify if what is documented there is the right information, and I'm going to be using that to validate the C's right, which is the right to patient, right to medication, right to dose, right to route, right to time, and right to documentation. So I'll be looking at the physician order and the medication record now to confirm the information. First thing to look up to is the name of the patient, Buzo Jack, well documented, the MR number, medical record number 87134651, well documented, date of birth 06/20/1975, well documented, Allen Long, MD, well documented, the date dash 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 2020, well documented, the medication, the first medication, the is Sevaclor 500 mg PQ 4 hours for infection to be administered at 8:30, well documented in the medication record. The physician order, the second medication says at 8:30 for the right date, Synthroid 100 mcg PQAM, and is well documented. And the third medication says at 8:30 Nitrobid 2% ointment topical QAM 1 inch on patient's chest, well documented and clearly written in the medication record. And the person that entered the information, the medication, append the signature and the physician signature right here, and they say no allergy known for this patient. So I've been able to compare the two information. There is no mistake anywhere. It is correctly and rightly documented. So with this, I'm going to be doing, like I said, I'm going to be doing 3 checks. I'm going to start my first check now by performing hand hygiene. So I have my sanitizer, then I'll put on my glove. The first check is I'm going to be pulling off my medication from the drawer, which I'll be using the information I have to affirm and pick what is required of me. First medication says Sevaclor 500 mg PQ 4 hours for infection. From the drawer, I've been able to pull out, and I have Sevaclor 250 mg by 5 ml. This is not the required dose, so I'm going to be taking time to calculate the appropriate dose to be administered to my patient. So I'll set that aside. For the second medication, I'll pull it out from the drawer just to be sure of what is required. Okay, I've been able to see Synthroid, but it says 100 mcg. Okay. Oh, I'm so fortunate. I have 100 mcg of Synthroid, so I'm going to set that aside too. And for the third medication, pull out from the drawer, Nitrobid 2% ointment topical QAM 1 inch on patient's head. So I've been able to see Nitrobid. This is Nitrobid ointment. Then it says 1 inch on patient's head. I'm going to have along with me the paper that I'm going to use to measure. So I have 3 medications, and I've been able to pull out the 3 medications. So I've been able to confirm. Then in order to complete my first check, I'm going to be going into the nursing drug preference book in order to confirm if the dosage are right, the uses that is stated in the information are right. Then I have Sevaclor. I have with me Sevaclor. Generic name cephalosporin. The dosage says antibiotics PO 250 to 500 mg 8 Q8R, and in the medication record and the physician order it says PQ 4 hours for infection. Anyway, the doctor must have had a reason to have stated 4 hours while the book is saying 8 hours. Maybe because of the patient, depending on the patient. That's why it is stated that way. So it says it is used to treat bacterial infections such as pneumonia, and the doctor has already stated for infection. The things to watch out for after you take the Sevaclor, it says dizziness, diarrhea, stomach upset, headache, vomiting. Those are the side effects, the things you really need to watch out for whenever you take the medication. So that is for Sevaclor. For Synthroid, I have here Synthroid 100 mcg PQAM. So from the information I have here, it says is a generic name levothyroxine. It's used to provide more thyroid hormone. The dosage adult less than 50 PO 160 mcg kg per day. And the information I have in the medical record says Synthroid 100 mcg PQAM, which is an accurate and appropriate dose to be administered for the age range of this patient, which is good. It says the side effect is sweating, anxiety, headache, insomnia, nausea, fever and hot flasher. So those are the things to watch out for. Then for the last medication, which is Nitrobid, the Nitrobid. Okay, for the Nitrobid, the generic name is nitroglycerin. It's a topical ointment to be administered on the patient, and its action is it decreases preload and afterload, which are responsible for decreasing left ventricular and diastolic pressure, systematic vascular resistance, dilate coronary artery, improve blood flow through coronary vasculate, dilate artery and venous bed systematically. It is used to treat chronic stable angina pectoris, paralysis of angina pain, acute control hypotension for surgical procedure on future. To administer it, topical ointment should be measured on paper supplied. Use paper to spread on non-hairy of chest, abdomen, thighs, skin, then spread over 2 to 3 inches. Do not rub. Like I said, because of this patient, the doctor also said we should put 1 inch, and the book is saying 2 to 3 inches. And there is an instruction that we should use paper to spread it on the patient's chest, like the doctor rightly said, on the patient's chest, on the non-hairy part, and it says do not rub. So those are the things I need to educate my patients with. So I've been able to complete my first check. So now I'm going to perform hand hygiene. I'll put on a new glove, and I'll be going for the second check, which is preparing my medication and putting it in the cup and taking measurement. So for the Sevaclor 500 mg, I have it here. For the Synthroid, it says 100 mcg. So the Synthroid is okay. I'm going to put that in the cup, which is ready to be taken. And I have the Nitrobid 2% ointment. I've been able to confirm I have the Nitrobid and the paper. I'm going to put that aside. So only for me to measure the amount of the Sevaclor to be administered. To do that, since what I have is 5/250, cross multiply the unknown over required. Therefore, I have x equals to 5 times 500 divided by 250. Then I'll use my calculator. This gives me 500 multiplied by 5, which is 2005, divided by 250. It gives me 10 ml. That is, I'm going to be administering 10 ml of Sevaclor to my patient. So with that, I'll have to sit my cup on the table. Then I'll go down this way and I'll take time to measure. So I'm going to measure the Sevaclor. Okay. I have been able to measure 10 ml of Sevaclor. So this is what I'll be taking to the patient's room, and not this old bottle. So I have ready Sevaclor 10 ml, Synthroid 100 mcg, then the Nitrobid 2% ointment, and the paper to take a measuring. So now I'm ready to go to the patient. Okay, now I'm in the patient's room. I put down my medication. Hello, miss. How are you doing today? Oh, my name is Temi. I'm a student nurse from Mountain View College. I'm here to administer your medication this morning. Would that be okay with you? Okay. Do you have any allergy? Can you swallow? Okay. Okay. Can you please verify your name? Buzajab. Thank you. Your date of birth? Okay. Good. That's fine. Before I do that, I'm going to perform. I'm going to make sure the bed in a comfortable position. Okay. Okay, and please lift your head up in the seated position. Allow me to provide privacy here. Then I'm going to perform hand hygiene. So I perform hand hygiene. Okay, Miss Jack, one moment before I give you your medication, I want to do my third check. I want to confirm the medication I brought in. Okay, I have Sevaclor 500 mcg/PQ. Here is 10 ml of Sevaclor. Here is Synthroid 100. Okay. Then here is Nitrobid. Oh, okay. Miss Jack, are you ready to take your medication now? You already told me you don't have any allergy and you can swallow. Good. Okay, can you please open your mouth? Then I'll open the Synthroid in the cup. Give it to her. Then I'll give her water to wash it down. Are you okay? The second one, which is Sevaclor. The Sevaclor. Then the Nitrobid ointment. I'm going to measure that in the paper. One moment, please. Okay. So I'm going to be administering this on her chest, on non-hairy parts. Hello, let me put this on your chest. Good. Okay, please, Miss Jack, do not rub that. That is the order from your physician. I have been able to do that. I'll take off my hand glove, perform hand hygiene, and put on a new glove. Miss Jack, please, I want to ask, do you have any patch on you? Can you show me? Oh, right here? Okay. Please allow me to look at the patch. Oh, this is old. And I'll carefully remove the pad. I'll drop it in the biohazard box. Then I'll wash the residual area. I'll wash it. Okay. Now I'll take off my hand glove, perform hand hygiene again, put on a new glove. Miss Jack, I'm going to put in a clean pad on your skin. Please allow me a few moments. Then I'll put the date, the time, and my initials on the pad. Then I'll put the pad on her. So that is that for the pad. So Miss Jack, are you okay? Okay, let me put your bed bath in the normal position. Okay, and your head, are you comfortable? I'm going to take off my hand glove again. Please feel free to call me in case you have any issue, in case you have anything to tell me. I'll be stepping out to the huddle room, but I'll be back in the next few minutes, like 30 to 40 minutes, to check on you. Here is your bell by your bedside. I'll be going to attend to other patients. Thank you. Okay, I'm going to perform hand hygiene again. Wash, put on a new glove. Now, for the sublingual and the buccal medication. For the sublingual medication, I have to place the medication right under the tongue, and I'm going to educate my patient. Please do not swallow, do not drink water, do not chew, do not eat while you are taking this. That is for the sublingual. For the buccal, it goes in between the gum and the cheek. Right here, I'm going to put the medication right between the gum and the cheek, and I'm going to tell my patient the same thing. Do not eat, do not swallow, do not drink water while you take it. Please don't always forget, I'll perform hand hygiene. Again, I'll perform a hand hygiene, and I'll be going to instilling hydro. In instilling hydro, I'll have my cotton bud or a tissue. I'll ask my patient to, on the lower eyelid, I'll have to hold the lower eyelid, and I'll have my patient to look at the ceiling this way. Then I'll hold the dropper above the conjunctivitis sac. Then I will still instill the number of drops. Then I'll apply gently pressure on the lacrimal duct. So in case it is an ointment, I will apply pressure. I will apply it evenly on the lower eyelids, and I'll have my patient to close the eyes. And in case I'm going to put patch, that is for the eye, I'll perform hand hygiene again. I'll put on a new glove. For the nasal, I'll have my patient hold the nose to breathe. Then I'll have to make sure that the head is tilted back in a supine position. Then I will hold the dropper above the nurse. Then I will instill the number of drops into the nurse. So that is that. For the hair, I'm going to have the medication rub in my hand, warm for under normal room temperature. Then I'm going to tell my patient I'm going to pull the pinner up and backward. Then I'll have my patient to stay sideways for 5 minutes. Then I will still the number of drops. So that is for the nasal. I'll perform hand hygiene again and to the enema. How do I do with the enema? In case I want to do it in the patient rooms and on the bed, first thing I'm going to do is I'll make sure I make provision for the bedpan for commode, and there is access to the toilet. I'll make sure on the bed I have a water padded pad on the bed, and I'll make sure the 2 rails of the bed are up. And when I'm ready to administer the tubing into the anus, I'll go make sure I'll pull down the side which I'm going to work with, majorly maybe the right side. Then I'll have my patient move towards the left side. Then I will locate the buttocks. Then I will lubricate the tube of the enema. This is not, I'm just using this for demonstration. I will locate like 3 to 4 cm of the tube of the enema. Then I will insert it carefully into the anus towards the umbilicus. Then I will leave for like 5 to 15 minutes for the patient to go. In case there's going to be any accident, the bed will not be stained. That's why I have the water padded pad on the bed. Then I will use this paper towel to hold the tip this way. Then I will discard. Then in case the patient is going, then that is for the enema. I will perform perineal care. Then I'll make sure I adjust the bed, and I'll perform hand hygiene. So that is what I have to discuss. Thank you.